Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you another in our series of interviews with top leaders in healthcare IT. And our guest today is Dave Pennino. He's founder and CEO at LogicSource. Welcome, Dave.
Thank you very much for having me.
Yeah, excited to have you on. Since I first met LogicSource, I've been fascinated by the work you do and how you're bringing in other industry knowledge into healthcare. So I'm excited to hear about your story. But for those that don't know you, tell us a little bit about yourself and LogicSource, along with kind of what inspired you to start the company.
Great. Well, again, thank you for having me on. And briefly, I grew up in Norwalk, Connecticut, and professionally grew up at Gartner, largest IT advisory firm in the world, and learned an awful lot about business and kind of how to start a company and how to run a company and all those things from my time at Gartner. And it was very fortunate throughout my career to have a set of incredible mentors, one of them being Manny Fernandez, the chairman and CEO of Gartner, and then Michael Fleischer, the next chairman and CEO of Gartner. And I went into the dot-com world at Scient, and Bob Howe, who was one of the founders of IBM Global Services, was a mentor of mine. So I've been very fortunate over the years to have folks like that around me. And that led me to want to start this company. I've been an entrepreneur since I was old enough to get 50 cents to shovel the neighbor's driveway or turn on a neighbor's stove on the Sabbath. And I grew up in this very unique street that had a Baptist church on the right and a temple on the left. And yeah, I saw the economics in that. I could do things for both sides of the street and make my money. And I wanted to start my own business. And one of the things I did for Gartner was run their IBM account worldwide and just became fascinated with how IBM built their retained professional, sort of tech-enabled professional services business. And I thought, boy, where else could I do that in the enterprise? And simply put, buying stuff jumped off the table at me. I could create a, kind of massive corporate Costco, if you will. And that's what we've done over the last 16 years. We've built a company with substantial scale and leverage that helps companies in multiple industries drive profit improvement, reduce risk, et cetera. So
Yeah.
I've got four daughters, a wife. I've been married 27 years, I think, this year, if my math serves me. And
Wow.
I live in Charleston, South
Congratulations.
Carolina now.
That's awesome. I love the story. I mean, yeah, I was just telling someone yesterday. I've been an entrepreneur since I was a kid, so I feel your same path. Obviously, different forms of entrepreneurship, but it's interesting. LogicSource started in 2009, so you've been around for quite a while. And like you said, you started focusing on consumer brands, cutting indirect expenses such as facilities, IT, packaging. You've worked with a bunch of big names: Lululemon, Titleist, Bath and Body Works. I love seeing the list. It's fascinating for healthcare to see that list. So what pushed LogicSource to kind of expand into healthcare and talk about what that transition was like? You're not a healthcare guy by background. You're working
Yeah.
at Gartner. So tell me about that.
Yeah, it's interesting. I actually thought of this last night. I was just kind of staring at the ceiling, thinking about my day to day, and I was looking at this interview, and I was thinking about the genesis of our healthcare business. And I was reminded, I don't know how this memory popped into my head, but years ago, a chairman of mine introduced me to the CEO of Scripps out in San Diego. And I walk in, and we had this amazing CEO meeting, and he said, "Well, we get everything through our GPO," and the meeting just died. And we never looked at healthcare again until a few years ago. And I just remembered that last night for some reason, so I need to call on Scripps. But actually, COVID, believe it or not, was the genesis, and not in the way you would guess. I live in Charleston. Houses down here are about 12 feet apart, and my neighbor during COVID was the incoming CEO of Roper St. Francis Health System here in Charleston. And as you know, during COVID, everybody was kind of keeping to themselves. We would sit on the front porch or back porch, and you kind of created these closed communities. And his family, his name was Brian White. Brian's family of four kids and his wife, and my family of four kids and my wife kind of existed in this compound. He had a pool, and we would barbecue and go back and forth to his compound. But between the two houses, we just spent a lot of time together. And as you do with your neighbors, eventually we said, "What do you both do for a living?" And we started chatting. And he said, "Boy, why don't you do that for health systems? If you can do that for Lululemon and Tractor Supply and Gap and Bath and Body and Titleist and all these amazing brands, why not health systems?" And I told him the script story, and he said, I think that's a data set of one. I think we could really use the help. And it was Brian who kind of pushed me. And he ended up getting sick and not being able to take the job at Roper. And he was a very mischievous gentleman. So he would sit on my porch every day and distract my meetings and try to get my dog to bark and kind of genuinely cause trouble. But he started to become really kind of excited about this healthcare idea. So he called 4 or 5 CFO buddies of his that were in health systems, and he ran a couple of hypotheses down. One, in consumer businesses, about 20% of revenue is the stuff we buy. A consumer brand would call it goods not for resale. A CPG company would call it indirect. The health system space calls it purchase services or non-med surge. And so hypothesis one, if it's 20% at Lululemon or Gap, what is it in a health system? And it turned out it was 20 to 25%. The second hypothesis he ran down was that the categories that are really interesting are facilities, design and construction, marketing, IT, distribution, logistics, et cetera, and packaging. And the only one that didn't line up with health systems was packaging. They don't package anything. But everything else lined up. You buy software, you buy hardware, you maintain floors and escalators and elevators, you buy marketing, outdoor media, you buy digital media, social media, print media. So it all lined up. And then the last one was this GPO thing. So these GPOs are unusually prolific in healthcare. So we did a bunch of work. We pulled about 20 companies' AP feeds, accounts payable feeds, because of his relationships. And we found that the lowest amount we found was supported by a GPO was 12% of purchase services, non-medical surgical expenditures. The best or the highest we saw was 26%. That doesn't mean it was covered well, it just means it was covered. So that meant if you left the GPOs completely alone, you still had 75% of the spend that you could go play with. And we said, well, why not? Let's go do it. And he joined the firm, and he helped us get this started. He passed away regrettably, and if it wasn't for him, it's now 62% of my business. My pipeline going forward is health and life sciences, and it was his legacy that he brought to this company.
Yeah, thanks for sharing that. And I mean, it reminds me of so many stories I've heard where you need someone who understands the culture of healthcare to be able to crack it in many ways. And it sounds like you were blessed to have a neighbor that could help do that for you. What
Very
would you
much.
say surprised you most about the healthcare industry when LogicSource first began working with hospitals and health systems?
So I'd say I'll take that as what will be perceived as a positive, and one that will be perceived as a negative. One, I was blown away by the overlap. I actually didn't believe at first that buying for retail and CPG would be relevant. And the overlap was incredible. And now we don't run away from it, we run at it. If you interviewed 5,000 healthcare CFOs, they'd all tell you the same thing. We know we're inefficient, and we compare ourselves to each other. So it's actually far more interesting that we're comparing them not only to each other, but to folks from outside their industry. And so I found that fascinating. The overlap's incredible. And I will tell you, one of our health system supply chain officers said this, and I thought it was hysterical. And I just attended an amazing wedding this weekend. He said, healthcare pricing is like wedding pricing. And this gentleman came from industry and moved to healthcare.
Okay.
And he said, and I said, what do you mean? He goes, well, we all know the tent doesn't cost that much, and the flowers don't cost that much, and the photography doesn't cost that much, but you're getting married, so we're going to double the price on everything. And he's right. We go into these health systems and they get fleeced by their suppliers. We look at the prices that we're paying in a publicly traded company for the same goods and services, and they get better deals. So comparing yourselves to each other is a flawed strategy, and only using GPOs that only come from your industry is a flawed strategy. You have to get insight from outside your industry. So I'd say that the positive was the overlap's incredible. I'd say the negative is very, very slow and bureaucratic. So trying to save people money in general, which is all I do for a living, is shockingly difficult. The health system space, it takes that to a whole new level. And I'll give you an example. With limited exception, and there's been some amazing ones, Stanford Health is one of the fastest moving, most amazing group of people I've ever worked with, for example. And there's more if I didn't mention one. But an NDA, just a mutual non-disclosure agreement in a publicly traded company, takes on average 48 hours if we use our paper and there's red lines.
Mm-hmm.
In a health system, on average, it is taking 4 months to get an NDA signed, their paper, no red lines. And everything else flows off that. How fast can we get data? How fast can we meet with senior stakeholders to understand what they're buying, who they're buying it from, et cetera? So the That's been shocking to me. And I think that what I've come to conclude is they're so wildly underfunded that their executives are doing 20 different jobs and they
Hmm.
just don't have the bandwidth to work on the business because they can't stop working in the business.
Mm. Yeah, I mean that feels like an entire episode on its own. But you're right. Like healthcare is complex and slow to change. So how does LogicSource kind of overcome that resistance and hopefully inspire innovation in these hospitals?
What we're finding is that it's all about sponsorship. So if you can get to the CAO, the CFO, the COO, the CEO in some instances, everything gets a little bit easier because they need to save money. And if you think about Doge and inflation, in no particular order, Doge, inflation, tariffs, and now the big beautiful bill, no political commentary at all. It's just putting a lot of pressure on a business that can't raise price the way our publicly traded companies can. They can move things around aggressively in corporate America. You can't
Right.
in a
Yeah.
non-for-profit,
It's often
especially
defined
health.
by payer contracts.
Correct. So I think there is if you will, these headwinds that they're facing are creating tailwinds for folks like us that are saying, hey, let us come in here on our nickel and bring the arms and legs to drive the efficiency because now more than ever they need the money. And you got to put in perspective about 20% of system-wide revenue, to give you a size of the prize, this 20% of system-wide revenue is going to be purchase services, non-med surge expenditures. We're going to save somewhere between 6 and 16, 6 and 20% on that 20%. We're talking big numbers that they can drop to the bottom line and either fund future development of new, care facilities or more likely, be able to continue to operate without having to cut critical costs like services, ratio of nurses to patients, et cetera.
Yeah. You're spot on that. We had the CIO on a panel at our Sway Health marketing conference, and they asked, what can you do in this current environment? And he said, if it's not cutting costs, we can't do it. Like he just said it that directly, that like, sure, you can educate me for the future and we can be primed for when that changes. But right now, it's cut costs or nothing. Obviously they can do their existing stuff and whatnot. But yeah, it was exactly what you said. It's
Yeah.
a tough situation.
Yeah. And a lot of times, by the way, with the CIO, it's like, how do I make your budget go further? Because they also have things like data breaches and like real issues that they have
Yeah.
to manage. And there's no free budget line around to go deal with that. So how do we make your budget go further? Because it's not always about saving money and dropping it to the bottom line. It can also be about you're not getting any more money. So how do
Yeah.
I make your budget go 10 to 20% further so you can do the things you need to do for the same amount of money?
Yeah. Let alone AI, right? Where's that budget coming from? It's a good point.
Well, and yeah, that's another that could be a whole on how many phone calls I get from CFOs saying, "What is this new AI tool? I just got asked to sign for one last week, and 2 weeks before that, what is this?" That's gotten a little out of control too.
Well, and it's going to get worse. Could you share maybe a specific example of how LogicSource's experience in the retail sector gives hospital clients, an unexpected advantage? It was interesting your comparison to GPOs that are just healthcare. There's value in understanding the industry, but I get the idea like there's value in understanding the other industries. Share an example of how that works, using the retail to give hospital clients an advantage.
Sure. So think about something just simple and mundane. Security guards. When I look at what our big box retailers pay for the same security companies in the same market as a hospital system, it's about 12% cheaper.
Wow.
And we're talking about a uniformed guard with a gun standing at the door, right? Same spec, 12, 15% more expensive. Escalator maintenance, elevator maintenance, floor care, waste management. A big example that jumps off credit card processing. Now you think about how many people walk into a retail store these days, especially high-end fashion with cash. It's all credit cards.
Hmm.
And you very rarely pay at the hospital with cash. It's all credit
Yeah.
cards. And I don't know if it's the suppliers overcharging or it's just the know-how to negotiate. When I mentioned credit card processing to a health system, they're like, yeah, I don't know who's ever looked at that. And then I think it's just bandwidth, that there's so many of these things, but software is another great example. I think a lot of healthcare specific software companies have kind of hoodwinked their clients into thinking, no, this is special because it's healthcare, it's different. It's a software license. They just charge too much.
That's fascinating. I guess one other theory is that, in healthcare, we focus on the bottom line, but not the same way a for-profit company does. And so if you're someone, you're like, oh, well, we need credit card processing, we're gonna have it. And do I really care if it affects the bottom line? We're gonna pay for it either way. So and maybe it's that mindset as well, right? Where it's like, we say no margin, no mission, which is fine, right? And that's why it's important the work that it's doing. But I don't know. Maybe that's my theory is maybe it's a bit
I
of a
I think
mindset.
you're John, I think you're on it, right? Which is, and I've actually been meaning to, I need Erica to lock me in a room with a computer one day to do this. I've been meaning to write all the findings I've had on mission-based culture versus profit-based culture. And there's positives and negatives on both sides. But when you look at some of our publicly traded clients, those executives are all compensated on profit. So
Yeah.
you're going to look at that credit card processing deal. You're going to look at that software renewal, in a way that you might not if it's your mission based. And look, I used to be in years ago, I was in sales at Gartner, and I can't tell you how many times I'd get a phone call of somebody saying to me that, hey, it's November, I've got 60 grand left in my budget, do you have something you could sell me because I'm going to lose the budget? Like,
Those are
that's
the best calls. I love those.
madness, right? And I think there is something to be said for mission based versus profit based, but I also think it's a head count issue, right? So
Mm,
I, I have been blown away at how few people are in purchase services within massive health systems. That's their full-time job, is negotiating these things. And I think the other thing is that very often they're understaffed, they don't have software, they don't have technology. And then they also don't cover every aspect of it. Some of Gartner's highest ranked supply chains in healthcare don't own major swaths of spend like IT, marketing, logistics, design, and construction, but they're the highest ranked supply chains in the country. How's that possible?
amazing. So, we talked about using other industries to kind of influence your healthcare work. How has LogicSource success in healthcare kind of shaped your broader vision for the company?
It's been fascinating. In fact, I have a meeting coming up next week, and one of the things we're debating is what other verticals should we open? And I feel like we have, and we'll see. I'm preempting a board meeting, but I think the data shows us health and life sciences has so much runway. It's such a high percentage of GDP. Competitively, we feel very comfortable. I think it has shown me that I should double down on this. Um, I love retail and CPG. I already have a lot of, artillery pointed at that. I think I should continue this journey in health and life sciences. In terms of learnings, I will tell you one thing. It took longer and was
Mm,
harder than I thought it would be, having no brand recognition whatsoever in that industry. But now that we're in it, and we've been so fortunate to be able to call people like Cleveland Clinic Partners, Stanford Health, Scion, SSM, Alina, Greater Baltimore, et cetera, we are finding they flock. The industry likes to see what each other is doing, which is really fun and scary for an entrepreneur like me. It's fun because they flock and that means growth. It's scary because I don't want so much as a spelling error out there in our universe because I want them all to be really happy with us.
yeah, for sure. Well, we always like to wrap up with a little career discussion on a lot of our episodes. And it's interesting. We started off with the fact that, you started Logic Source wanting to be an entrepreneur. What would you maybe tell your past self or or maybe change from the beginning with the knowledge experience that you now have after 16 years as CEO of LogicSource?
Oh man, we need a good bottle of wine and a
Well, you'll
couch
have
for
to come
this
visit
one.
Vegas sometime. That sounds good.
Yeah,
Next Sims, we'll hang out.
it's a long list. And if I compartmentalize it, from a leadership perspective, I think the single biggest lesson learned is one, surround yourself with people you'd be afraid to compete with at every level, and then get out of their way and let them do what you hired them to do. And I think it took me too long to do that. As a founder and entrepreneur, you want to dabble in everything. And I think knowing your own intellect and your own limitations is probably the single greatest accomplishment you can have as a founder. So I'm good at firing up the team. I'm good at recruiting people to join the company. I'm good at talking to new and existing customers. That's what I'm good at. So go do that and stay out of the other stuff. And it took me too long to do that. So we probably spent longer getting to where we needed to be than we should have. I think that I'm a founders can be, naturally suspicious people. And I've been surrounded right now. I'm partnering with a world-class, team of people from FTV Capital, and, probably embracing my investors, instead of trying to hold them at bay, is probably something I would tell my former self, let them in a little bit. And interestingly, I'm going to contradict that when I say, but trust your gut, and do what you know how to do and go do it. So I think there's a lot there. There's a whole bunch of other technical stuff around how my first deal was written, how we financed the company, how we use debt, that kind of stuff that there's a lot of lessons learned in there. I will say I started the company as a 35-year-old with two and a half kids, assets, not for the faint of heart. Most people start companies when they have nothing to lose or they've already made enough money that they're not worried about it. I did it at 35, which God bless my wife and kids because they've taken this whole ride, whether they had a say in it or not.
I know the feeling. I was 30 with two kids when I quit the day job. So I
There you
feel you.
go.
Dave, this is awesome. Appreciate you sharing the vision of what LogicSource is doing and what you're accomplishing for healthcare organizations. I definitely feel like it's something that's not talked about enough, and so I appreciate you shedding light on what's possible. And I think especially in this time where cutting costs is so important, I think you have a really valuable message. So I appreciate you taking time to share your insights and perspectives. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast applications. Thanks, Dave.
Thank you very much for your time.